Okay, good morning, everyone. It's about 9 o'clock, so we're gonna get started. Just make sure that. Okay, we are recording the meeting and it's being live streamed to our YouTube channel. So good morning. I'm just gonna read through the participants that I have, and if you're on the Zoom and I didn't mention your name, just let me know. I know some people will probably jump on as we get started, but just want to get attendance. I have Jeanette Catamarino, Art Clayman, Benjamin Welk, Carrie Ward, Charles Welge, Tina Carton, Dave Wooden, Fred Mastriani, Ivan Vamos, Jim Moore, Jody Binnix, John Demira, Lauren Stairs, Linda Vonderheide, Melissa Cherubino, Valerie Dean, and Rogerio Rodriguez. Did I miss anybody? Okay. Okay, so just some housekeeping and updates. As you all know, CDTC has been gradually reopening the office in accordance with CDC guidelines and local public health recommendations. So the office right now is open 5 days a week. Staff is in alternating shifts 4 days a week, but we can be reached more easily now by phone. If you are visiting CDTC, we still ask that you do wear a mask and that you schedule your meeting prior to arriving. And we are trying to continue to hold most meetings virtually. Some meetings like Planning Committee and Policy Board where there's voting, and soon we'll be getting into TIP programming. Those will be held more of a hybrid where for our voting members to attend in person. And we are going to try to look for a meeting space where we can accommodate more people safely. So we're continuing to monitor evolving situation with COVID-19 and variants, and we will update folks if anything changes. So with that, I would like to introduce our speakers today. We have Jody Binnix from the Genesee Transportation Council, and we also have Benjamin Welk. Did I pronounce that right? I think I
did. Yeah.
Okay. Hi, Benjamin.
Fine. Good to see you again, Jen.
And so I'm going to share. How are you? Good to see you too. So Jody, I'm going to share your presentation. Can you see it?
Yes, thank you, Jen. Can everybody hear me okay? Like I said, I had to jump on the laptop, so. So I do have Ben with me today, and I wanted to say, Ben, I believe he's working with Urban Design for Health at the moment, but he was the one that really completed the majority of work on the HIA. Unfortunately, Ben and I had an email miscommunication with my email being sent to his spam, but he's with us today. So Ben, I'm going to ask you if you want to jump in at any point and clarify something or add something that you think might be relevant, or we can just wait until the end when we do questions as well. So I did send Ben over my presentation, but Ben and I just got in touch yesterday afternoon, so it was pretty late in the game. So anyways, are you ready for me to get started, Jen? All set?
Yeah, I just wanted to mention to everyone that the Genesee Transportation Council is the MPO in the Rochester area. So they are a very similar organization to what CDTC is, which is why I thought that their work and involvement in these health impact assessments was very relevant and of interest to our group, because this is something that our group has been talking about and exploring to see how, if this is feasible to do in our planning process. So I just wanted to kind of give that context before jumping in, but.
Sure, I was going to touch on that as well.
Okay, sorry.
Oh, it's fine. It's fine. Okay. So as Jen mentioned, my name is Jody Binnix. I work for the Genesee Transportation Council. I'm a program manager. I focus primarily on long-range planning and performance measurement, and I got to be our staff representative on our health impact assessments project. So next slide, Jen. So as my presentation outline, I know when I talked to Jen about this, she was really focused on the process of how to get the HIA started, what steps do we take to kind of get it funded. So I'm not going to focus so much on the outcomes, like the recommendations. I'm going to kind of speak more to just our process of how we got the HIA off the ground, and then just kind of touching on some of the final stages. So next slide. So as Jen mentioned, Genesee Transportation Council is the MPO for the 9-county Genesee Finger Lakes area. We have about 180 municipalities. Rochester is our city center, our main metro area. So we're just down the thruway. We are, just like CDTC, although we do operate differently, so that, all the MPOs have the same functions, but how they carry out those functions does differ. So that's something to keep in mind as I kind of chat about our process. So next slide. So there's lots of definitions of an HIA. So for our process, what we decided on was this definition. So in case you're not familiar with what a health impact assessment, or HIA, is, it's a systematic assessment using qualitative and quantitative data to evaluate the potential health effects of any given initiative and develop recommendations to maximize the positive effects and minimize the negative ones. So the easiest way to think about it is looking at decision making through a health focused lens. So what would you do differently if you were focused on health? Okay, next slide, Jen. So why did we want to do this? This kind of process first started for GTC quite a while ago. Back in 2011, we had our long range transportation plan at the time. We have a set of what we call emerging issues and opportunities that are different up and coming topics kind of influencing transportation planning. One of these was the transportation system's role in public health beyond safety. That was identified in our 2011 plan. And that was just kind of recognizing that, the transportation planning profession really needs to think more broadly about public health and not be so focused on accidents, incidents, fatalities, injuries, kind of what you traditionally think as like a safety need along the highway system. More, we need to start focusing on how the built environment really impacts people's health. If you live in a walkable neighborhood, are you more likely to walk? Do you have access to food? Just different things like that. Or are you auto dependent? And if you live in an auto dependent community, do you have access to transit? Just kind of thinking through, how people access food, healthcare, and even how much walkability and bikeability you have to kind of, have healthier outcomes for your physical health as well. And so in the 2011 plan, we specifically called out that we wanted to study and do this HIA process. And I think Jen's mentioned that CDTC has done the same thing in their long range plans as well. Okay, next slide. So when we first started this process, and I wasn't the one to do the initial talks, but I definitely was kind of started when we first kind of started talking about it, we brought on Common Ground Health. So we realized that GTC could not admin the project alone. This wasn't something that, we could just kind of do ourselves. We really needed a partner in the region. Common Ground Health is a health planning systems agency. You see on the map, the blue counties, that's Common Ground's health kind of geographic territories. It is similar to ours. It's not exactly the same, but which, kind of was a little bit challenging at times through the HIA process, because our funding could only cover our counties, while their funding could kind of reach down into the southern tier of New York, which, we didn't really have access to, I guess you could say. So we decided that Common Ground Health was going to serve as our consultant for the process, mainly because they had access to healthcare data that not like, a typical engineering planning firm would necessarily have access to. And in total, it was a 4-year process. When we first got the funding for the project or applied for the funding, it took about 4 years to finish it. And a lot of that was on the front end. It really took us a long time to get a proper contracting procedure in place. So next slide. So how did we fund the HIA? I'm sure that's the main question a lot of agencies have when they start to do this. So we have what's called our UPWP process, which is our Unified Planning Work Program. It's basically, what we're going to do. It's like our capital planning our transportation planning projects for the next year, what we're going to work on. is that we have to apply for that funding. Even though it's our funding, we share our funding with our member agencies and all the municipalities in our region. I guess it would be similar to CDTC's linkage program. I think they share funding with some local municipalities as well. So GTC partnered with Common Ground Health, and we applied for funding for the HIA through our UPWP process back in the fall of 2014. So we were successful in getting funding. So we asked for $60,000 from federal highways, which is our planning funds. The planning funds are the funds that run the MPO. They're funds that come to GTC from the federal government. Common Ground Health contributed $30,000. So they had about a third of the budget. So the total cost was $90,000, I believe, and Ben, you can correct me if I'm mistaken on this, but I'm pretty sure that Common Ground Health ran over budget on this. It just took a little bit longer to get done than we thought. I think we ran in, it was the first time doing this for both agencies. So, they did kind of go over budget. I think I was billed out on the federal highway side before we were done. And what we ended up doing was signing an MOU with them. And I can talk more to Jen about this kind of after the meeting, or if we want to get into it today, we can do that too. But as I mentioned before, we decided Common Ground Health was going to serve as our consultant, but it didn't follow our typical procurement process where we'd go out for like an RFP, request for proposals, or request for information. And given the dollar amount, $90,000, we kind of had to figure out how to get Common Ground Health on board without going out for an RFP. So we ended up signing an MOU with them, and that kind of whole procurement issue did take us a while to work through, and that's a lot of that 4-year timeline. So next slide. So what we did when we started this process was Ben just came on board. I think Ben was specifically hired to mainly work on the HIA process. So he received some training on this, and we decided to use the Pew Charitable Trust 6-step process. So for our purposes, when we started the HIA, we really just kind of focused on 1 through 5, the screening, scoping, assessment, recommendations, and reporting phases. I would say right now we're probably in the whole monitoring evaluation phase. That wasn't really possible when we were in depth on the project. And the framework, was applied to 2 case studies. So when we first scoped this project out, again, when we applied for funding through our grant process, we said in that application that we wanted to do 2 different case studies. So next slide, Jen. So when we selected the case studies, GTC and Common Ground Health kind of got together and went through a listing of possibilities. We decided on the bike share, the Rochester Bike Share, which was kind of new at the time, and also the Genesee Valley Greenway State Park. And so now I'll just kind of talk about those a little bit more individually. Next slide, Jen. So the bike share first came to Rochester back in 2017. We knew it was coming. I don't remember, the specifics of the timeline. If it had already started once we did, I think it had already started once we got the HIA underway. But when we were first thinking about selecting projects, it was really kind of just starting to take its foot in Rochester. Since 2017, it's undergone a lot of transformations. We've had multiple vendor changes. COVID-19 definitely impacted operations in 2020. It's currently being run by Hopper, and both bicycles and scooters are available. And it is outside of Rochester. I believe it's in some suburbs now as well. So it's not just focused on the city. Okay, next slide, Jen. So I think this was a really natural fit for the HIA process. There was a lot of information to really slice and dice. I mean, if you can imagine the bike share locations where they had a permanent spot. So it was really easy to kind of map out those locations and take census data, whether it's minority status, income status, and kind of overlay those and see if those bike share stations were really meeting the needs of communities that did not have access to a car. So that was I think something that was, kind of nice and neat about the bike share in the HIA process. So as part of this process, we also identified the steering committee for the project identified 4 healthcare determinants. And for the bike share, we did physical activity, because obviously if you're using the bike share, you're, using a bike, so you're being physically active. Social cohesion, which is how integrated and connected a community is socially. Economic benefit and equitable access, and food access. So you kind of sense the theme here. There's a lot of environmental justice type implications with the bike share. A lot of our communities in the city of Rochester, again, are low income, they have high minority populations. These populations tend to suffer, a lot more comorbidities, as we've seen with the COVID pandemic. They tend to suffer higher rates of heart disease, diabetes, et cetera. And there's not a lot of grocery stores in the city either. So do these communities have access to food? And another point of access was I think you still do with Hopper. I could be mistaken, but I think you need a smartphone and you need a credit card. So if you don't have access to a credit card or a smartphone, you're locked out of the system. So there was a lot of environmental justice type equitable access implications when we were looking at the bike share. So I do think as an outcome in the monitor and evaluation phase, I did not reach out specifically to the folks that were doing the bike share today, but I had the sense that, it's private sector driven. It's a lot harder to influence change for health's sake. So, we can say, oh, you need to have a bike station, or the bike share should be put into these, communities that are kind of disadvantaged. But at the end of the day, if their market analysis doesn't say that's where they're going to make money, that's not where these stations are going to end up. The stations are typically at points of interest, at colleges. So the people that really need the bike share because they don't have access to a car don't necessarily have access to it. So I do think because it's private sector driven, it's a little bit hard for us in the public sector to influence what they do with it. So the next slide. So the Genesee Valley Greenway State Park, it's a 90-mile trail extending north-south. It starts in the Rochester Genesee Valley Park, and it goes all the way through Livingston and Wyoming counties down to Allegheny County. Allegheny County is out of our planning area, but it's quite a long trail. It's basically a trail. There's on-road and off-road portions of it. It is a state park, which I was kind of surprised about. I didn't know it was a state park until we started this process. And it's also part of the Triple Divide Trail system, which you can see on the map, which starts in Rochester and it goes all the way south through Pennsylvania and ends near Williamsport. That's over 200 miles, and there's future plans to extend the off-road portion. So it's really part of this huge connected trail system that bisects the two states. So next slide. So again, we identified 4 healthcare determinants for the Greenway, physical activity again, you're walking, biking on the Greenway, access and infrastructure. I believe the Greenway was really one of the first trails that kind of got heavily developed in our region. Therefore, it needs to be maintained. There was lots of maintenance issues along the trail. Some portions of the trail were in better shape than others. Some were closed due to access issues. Safety, and again, that concept of social cohesion. So for both the bike share and the Genesee Valley Greenway State Park, the recommendations were really focused around these 4 healthcare determinants. And I believe I sent Jen the executive summaries, which kind of sum up the recommendations to send out to everybody. So next slide. So I think this HIA, and Ben, you can jump in if I'm misspeaking here, but I got the sense that it was a lot harder for Ben and at least for us as members of the steering committee to execute just due to the geographic scope. I mean, it's 90 miles, it's over 5 counties, 3 of which were in GTC's domain, again, where we can spend that federal planning funds on. The other 2 counties, I believe, were in Common Ground House, kind of geographic area as well. But it was really hard to get all the players at the table. I think, looking back on it, we really should have had NISDOT kind of, as part of our steering committee, because the Greenway State Park, this trail system does cross a lot of NISDOT facilities. And there's lots of issues with the crossings, but as you may or may not know, NISDOT is not a fan of mid-block crossings. So just kind of some recommendations we could have made, we felt like we couldn't just because NISDOT wasn't around the table. And if you can imagine, it's 90 miles. It starts in the center of Rochester, which is our metro area. It travels down through the suburbs. It travels out, through cornfields and through these small rural villages. So I think in the end, it was really hard to make solid recommendations that really were fit for every single type of place along the trail. So I think in that sense, it was kind of harder to kind of get our hands around it. So that was our kind of struggle with this one, I think. But next slide. So even though we've kind of struggled through the Greenway a little bit more, I think the outcome has been great. So I did reach out to Christina Irvine. She is the parks manager for the state park, and she's been very successful in getting TAP applications the Transportation Alternatives Program. She's been getting very successful getting funding to work on parts of the Greenway. And she noted to me, and I just pulled a few quotes that she sent me, but she's referenced the HIA throughout her grant applications. And I think it's been a huge resource for her, especially as a state parks manager, to have this kind of unique HIA health impact assessment document that she can pull from to kind of make her case for funding. And I know they just recently submitted a 2021 application. GTC wrote them a letter of recommendation for it. And they cited the HIA. So I think even though it was harder to execute, I think the outcome of this HIA has been very successful because as Christina's been, able to use it to get this funding. So next slide. And also, Ben and his team put together a lessons learned report. And I did not send this out, Jen. I don't think it's on our website, but I can send it to you after we get off the call. But it's kind of like a process insight report, just with takeaways, insights, lessons learned, and recommendations. It's pretty short, but I think it has a lot of, it's easy to digest. It's not real long. So I think if you're serious about doing an HIA, I think there's probably a lot of good information you can glean from this report as well. And that, I think, is it. I think I have one more slide, and that's just for questions. So Ben and I are both available to answer any questions that anybody may have. And Ben, I don't know if there's anything else that you want to kind of throw in there. I just kind of did a real high-level overview of what our process was and, how we kind of got to where we got.
Yeah, you did a great job. I appreciate you overviewing all of that. It's a lot of content to go through. I would just add real quickly that, one of the greatest benefits of conducting both of these health impact assessments was the steering committees that we put together, similar to your advisory committee that you have here for your project. We were able to engage with the state on multiple levels with New York State Parks. We had at the table, we had several counties worth of health directors. We were bringing in transportation planners and also community-based organizations. And so, what comes to mind is working with the advocate organizations like Friends of the Greenway and how useful this exercise came for them as well. One of the other funding awards that was actually announced for the Greenway was through the Ralph C. Wilson Jr. Foundation. There was a $6.5 million grant that was funded for trail resurfacing. And that was really focused on ADA compliancy. Basically, the Greenway has a slope that's accessible, but the trail conditions themselves are basically for mountain bikes. There's a lot of erosion and issues. And so that funding was actually used for trail enhancement and resurfacing on a 17-mile portion of the trail in a very highly populated area. And so the health impact assessment was very valuable for that. And then just one other note about the type of data. One other thing that really jumps out is the ability to identify vulnerable populations, and by able to look at that from not only a socioeconomic standpoint, but also combine that with both mental and physical health data, especially as it's related to chronic disease conditions. And so, for example, the Rochester Bike Share, within that health impact assessment, we actually created a proprietary index that we were able to apply at a census tract level across the city of Rochester to really look at issues of both, poverty, extreme poverty, as well as areas where health outcomes really needed, better mitigation. And so what had happened is in that first year of the bike share, really the first ever bike share the city of Rochester had, it had a tourist focus. It was being put in places that were not necessarily beneficial to the residents. We quickly identified that, with some new recommendations of new station placements in certain areas, that the health of the residents could be increased. And then, as Jody also did a great job of highlighting, there's also programmatic issues. And so one of the things about health impact assessments is you can look at things from both an infrastructure standpoint. You can also look at them from a programmatic standpoint. And so in this case, we actually were able to work with a $30 million venture capital funded bike share program that was national, and convinced them within the city of Rochester that they really needed to move away from credit card and smartphone only accessibility to the bike share and move to cash-based programs and even subsidized programs for areas where they did have the bike shares in impoverished areas. So just as a last point, I put a couple links into the chat of where both of these were published. One other note about that is, this is a fantastic way to get your projects awareness. I actually met Jennifer Saponis at the NISAMPO conference in Syracuse and did a panel presentation with her and Andy Beers of the Empire State Trail on the Genesee Valley Greenway. These were nationally published reports. They received significant media attention based on what we did. They actually led to a future health impact assessment that will be published, I believe, this fall on the Empire State Trail that we actually conducted, and all of these ramped up to that. So I think there's a lot of nuances to the benefits of these, the stakeholder engagement piece, the way you can look at data, the way you can touch both infrastructure and programs. And I'm happy to be a resource as much as possible. So I'll drop my email in the chat as well, and happy to answer any questions right now as well. Thanks.
I would say, thanks, Ben. Those are some great highlights you shared with us that I forgot to mention there. I will say too, when we first started this process, I think these 2 health impact assessments that we did, I believe at the time there was 2 or 3 in the entire state, including Metro New York. So these are kind of groundbreaking, especially for a small metropolitan planning organization, I guess mid-size. We're kind of mid-size metropolitan planning organization. The feds, our federal partners at Federal Highways and Federal Transit were very complimentary to GTC and Common Ground Health on our initiative to get these started and get them completed. So it's been a great project.
Great. So doing these, do you now have like a template that you can apply to future projects, whether it is a program or infrastructure? Is it now that you've done this, it's easier to kind of?
Yeah, I think so. I think the 6-step process that Jody highlighted, that's also in the introductory section of both health impact assessment we wrote about that 6-step process. That's really how we've templated the HIAs. They really did not change much. I leaned very, very heavily on the Genesee Valley Greenway health impact assessment when we were writing for the Empire State Trail. It was obviously very similar, looking at the health benefits of trail and trail access. And there was different nuances of that, that the Empire State Trail HI went further in terms of its identification of vulnerable populations, and explored kind of some different areas, but the template still held. So yeah, absolutely. I think there's not necessarily one way to write these, but I've certainly found a lot of synergy and uniformity in how I've been able to write them over time.
Okay. The Albany County Department of Health asked a question in the chat. What metrics are used to define success post-implementation?
I don't think that's something that we really decided on. And Ben, you can kind of correct me if I'm wrong. I'm not sure if we had like a solid answer for, how do we just define success? I think at the time, just getting these completed and kind of seeing where that led, it was such a new process, and it is I think health impacts are still kind of relatively rare. They're not, like just a typical transportation planning study. So I don't think we have a good metric for that.
Yeah, just add we did publish a monitoring and evaluation section. That's the last step of the health impact assessment process. And so there's a lot that can be put into that. I agree completely, Jody. I think, when these were the first 2 health impact assessments we had ever conducted, they were, the 3rd and 4th respectively in the entire state of New York. And so there was, I think with the recommendations process, certainly putting the recommendations down, arriving to consensus with your steering committees on what recommendations you want to pursue, and then trying to come up with some level of monitoring on those is helpful, but I wouldn't say that we were necessarily overly firm with those. I think we kind of had some targets, and in many ways, I would put that pressure on the recommendations that you actually publish in the report. I commonly call that the product of the HIAs. Is the goal really is once you've done the assessment and you understand the current conditions, it's really looking at how the recommendations you put forward can change the scenario. It's going to be what actually mitigates the health improvements. But some of that can be very simple. That can be, we're going to revisit, the health measures in 2 years from now or 3 years from now, or we're going to track the success of this one particular program that we've identified, or we're going to see how many miles with the trail we can get resurfaced and, check back in. And also, utilizing tools at your disposal to conducting surveys, with the public too, to see if things like access issues have improved over time, would all be recommendations I would put in that area.
Okay. And then we have another question. Does Rochester Bike Share program give discounts for low income riders?
I believe that Hopper does have an income-based plan. I'm not super familiar. Like I said, I didn't reach out to the folks that are running that, but I believe on their website they have some varying plan options, and they do have an income-based plan. I'm not sure what the criteria is for meeting that though.
Okay. And then another question, what is the receptivity of decision makers to thinking of things in these terms? Will their minds be changed and make them more inclined to plan and fund programs and infrastructure?
I would argue absolutely. I think the Genesee Valley Greenway is the most intriguing example of that. Really what we had was a trail that had a very large trail, 90 miles as mentioned, that had a very stagnant budget. They don't charge admission. It's free to get on. And so they don't have the ability to prove to New York State, even, from a user standpoint, how many people they're getting. They can't be funded directly from users. And so in this case, we really reanimated the discussion around the Genesee Valley Greenway and its purpose and how it could serve the residents and the community. And that led to the direct funding opportunities that were cited and mentioned. And I just absolutely don't think that would have occurred unless that had been really put into the vein and into the realm of how does a 90-mile rail to trail that already has organic connections with population centers, how does that actively improve people's overall mental and physical health? And I think funders were very receptive to that once that was put into that context.
Jody, do you know if these assessments are referenced or, quoted in applications for, and it did look like for TAP funding, but other grant applications or for proposals for projects for the TIP or anything?
I don't think they've been using the TIP. Our TIP necessarily wouldn't fund the bike share. I know RTS has been partnering with them, so I'm not sure. It would be federal transit funding for that. I'd have to ask Alex Cohn, he manages the TIP, but I would say no. I think it's been used in other grant applications like the TAP, and like Ben mentioned, I think it was the Robert Wood Johnson Foundation, Ben?
Ralph C. Wilson Jr.
Okay,
Yeah.
Okay, wrong one. But yeah, so I think they have been referenced, and I think anybody that is looking to get capital funding out of a grant program knows if you have a planning document that you can kind of pull from, your chances of succeeding and getting that funding do greatly increase. And I think it's important to know too that transportation planning, we typically rely on the gas tax, right? The federal highway side of those funding streams, and to kind of do the health impact assessment really opens you up for other non-traditional transportation funding. And I think that was a key component when we first started this from GTC's standpoint, was that our typical transportation capital funds are so competitive. We typically get 2/3 more in requests than we can fund every year for our TIP. And just trying to open up these new funding streams, because there is a lot of money in the public health sector. And how do we get the public health sector to realize, hey, if you do invest in this trail, you are going to have, like Ben mentioned, all these positive outcomes, and kind of make that connection and kind of go out and seek different funding opportunities. I think that was kind of a main overarching goal of GTC at the time when we funded this project.
Okay, any other questions from the advisory committee members? You can unmute or you can type it in the chat. Okay. All right. Well, thank you so much, Jody and Ben. This was really great and informative and helpful for us. We did share the executive summaries for each project prior to the meeting, but we'll send that out again with the notes. And then Jody, if you want to send that lessons learned, if that's something that we can share with our advisory committee, that would be great.
Yeah, I think that would be helpful. I think that was something, that to Ben's credit, they really put together at the end of the process, and they probably were feeling very burnt out on everything. But I think there's a lot of valuable insights, especially if CDTC wants to take something on like this. And also, Jen, if you want to schedule, a call offline with myself or Ben or any of us to kind of deep dive into more of that funding MOU contracting process as well, let me know.
Okay.
Or if you just have further questions, feel free to get a hold of us.
Great. Thank you so much.
Yeah, thank you.
Yeah.
Thank you. Best of luck with everything.
Thanks. Have a good day.
Okay. Bye guys.
Okay, so now I'm gonna switch back to the other presentation. Bear with me for a moment. Okay. Can everyone see the presentation screen?
Yes.
Okay. Okay. So we have some other agenda items today to cover. Our first item, which the presentation was kind of a good lead up to, is the 2022-23 Unified Planning Work Program, or the UPWP. So you may remember hearing about this. You may be very familiar with CDTC's UPWP. This has typically been a 2-year program of all of our federal transportation funding and how we intend to spend it over a 2-year period. So this is where, the linkage program is, capital coexists in the mini grants, but also, the staff funding that it takes to maintain and manage the advisory committee and do other bicycle and pedestrian planning tasks, as well as all of the other planning initiatives that happen here at CDTC. So with a new director and really trying to regroup and modernize, we are going to shift to a 1-year program for this next UPWP, just to try out some new things, see how it works, and then maybe go back to a 2-year, or just maybe stick to the 1-year program. It may be easier for us to track our progress within our projects and funding and so on. So one very new thing that we're doing with this UPWP is we are going to solicit for planning projects and programs. So instead of doing solicitations throughout the year for different projects or programs, like a separate solicitation for mini grants and a separate solicitation for a smart communities project and a separate linkage. Well, I think linkage is still actually going to be the same, but we do solicit for other types of planning initiatives. This year, we're going to do a solicitation for all types of planning projects and programs for the region. So we're asking the municipalities and local governments to submit proposals. There's no funding limit or cap right now. We are going to release some guidance and some criteria to how we're going to evaluate proposals. We want to try new things. We'd love to see, different towns, cities working together, intermunicipal types of projects and programs, ideas for regional projects or programs that, may be important to also important to towns and cities. And then staff is going to also recommend initiatives. So I wanted to just have a brief discussion and, propose some ideas to our group and see what your thoughts are. Looking back at the new visions, bicycle and pedestrian recommendations, there are a lot of recommendations, and going through, we actually have completed or are in the process of completing a few, but some other things that we said that we wanted to do over the next 5 to 10 years were developing a robust bicycle and pedestrian data collection program. So Carrie has been leading our initiative to help communities with ADA transition plans. We have also, we purchased, and we'll talk about this more in a little bit, we purchased the eco counters and have been deploying them to trails so that we can have a more ongoing trail count and census program. And the goal is to eventually have like an annual type of trail census or report for communities, and to be able to provide that data to everyone, but also, better public outreach and communication on safety information, creating route maps and mapping tools, and identifying barriers were also part of that. We also recommended measuring the economic value of walking and bicycling infrastructure. We partially did this in the trails plan, but we wanted to collect information on the costs of each type of infrastructure, and then get some, either identify some type of economic model or be able to have a tool to really measure the value of these projects. So we've partially done that. There's obviously room to do more. The New York State MPO Association Bicycle and Pedestrian Working Group is currently working on collecting infrastructure cost data. So that is something that might be better done kind of at the state level, and then we can just apply it here. We're developing a smart communities toolbox, and in that will be some guidance on automatic vehicle readiness, or connected vehicle readiness, and of course then the implications for bicyclists and pedestrians. We've really moved forward with the regional trail network, both in funding feasibility studies and also just the continued construction of that network. And we want to encourage to see that move forward, but we're also I don't want to really say shifting, but also kind of trying to encourage and promote maintenance plans for these trails more, because we're kind of running up just on the timeline of when these trails were built and how old they are. Some of them have had maintenance issues, and before we expand the network, we would like to see communities at least have a plan in place for how they're going to be maintained. And then, relevant to this morning's presentation, how can we integrate health impact assessments into the metropolitan planning process? Again, related to smart communities, leveraging technology to promote bike and ped transportation, cultivating partnerships in the Capital District. This is something we just try to do on an ongoing basis, and then providing training, educational opportunities, tools and resources specifically on bicycle and pedestrian infrastructure design to local planners and engineers. So we usually do trainings throughout the year, like the NACDO training or a federal highways training, but due to COVID over the last year and a half, we haven't done these kinds of in-person types of trainings. But if there are other tools or resources that local governments feel, CDTC can develop and that would be valuable for bicycle and pedestrian planning, we would love to hear. I don't know if anyone had any sort of thoughts or recommendations on, if the Bicycle and Pedestrian Advisory Committee were to propose at least one task to be funded over the next year for us, for CDTC to fund and to complete. If there is a preference of the advisory committee, I thought that the health impact assessments, this is something we have talked about probably for 5 or 6 years, right before the pandemic. I had met with the county departments of health, just to discuss, where CDTC can find data, how we can monitor health data, and how we could do health impact assessments. And there's a lot of different directions that they could go in, but also I think that kind of collecting the data, monitoring the data, it would be good to get someone perhaps to kind of like a consultant or someone on the outside to really assist us with that really understands the data and can identify reliable sources to for that data for us to monitor, and then for us to create a template, and whether or not we would use it on in the planning process or use it to evaluate programs and projects after they're implemented. That's just something I wanted to put out there. If anyone has any thoughts.
Let me try one first. The effects of COVID are still sort of with us and easily observable. In many cases, parts of sidewalks were taken over, and the sidewalks were ample, no problems, by local stores and eating establishments. It would be good to look to see how successful these are and how likely they are to be recommended to be retained. They do provide a lot of activity in the street versus inside, where you don't see the vibrancy of the cities. And it is, of course, seasonal, so for the most part. So it's worth examining that while this is still going on, and saying something about it should be kept up, or it should be increased, or it should be moved out of the way to make the sidewalks clearer for more people. But the more people don't always show up. Thank you.
Thanks, Ivan. I think that's something, we've been monitoring is, which communities have continued the outdoor dining programs. And, we do think that to some extent they're kind of here to stay, but perhaps, getting a better assessment on like the landscape of different outdoor eating programs, and then providing guidance to maintain accessibility and that kind of stuff would be helpful to local governments.
All right, if I can continue one more thing, I'm sorry, I forget her name already. Losing things even in the young lady that was giving the presentation about the Genesee Greenway.
Jody.
Sorry, Jody. It was a good presentation. She mentioned that she was in fact surprised that this fragmented 90-mile segment of trail system was a state park. Just from memory, which is about 45 years old, these were pieces of property, railroad rights of way and other properties, in some places canal rights of way, that were available. The state could get them, state parks could get them, sometimes counties did. The maintenance part was sort of made up out of whole cloth, and I speak to all of this system, including the Empire State Trail. It was sort of left, hopefully, to the local government that was responsible, sometimes by agreement, sometimes just by hope. It really requires a lot of review where there isn't a overriding program in place, which might be much of the Empire State Trail in our region. It's a thing a long time coming. In some of the foot trails, there are volunteer organizations that have been doing this for more than 100 years. Appalachian Trail, Long Path being examples, some in our region. It's worth looking at these things too, in terms of how will they actually be put together for a permanent system.
The Empire State Trail, Andy Beers has been going segment by segment to really figure out who owns and who maintains each segment, and we are finding some of the original pieces of the Mohawk Hudson Bike Hike Trail, the Erie Canalway Trail. We're really, we're kind of like handshake agreements with a local government. So there's been some back and forth, like, no, you maintain it. No, you maintain it. So Andy Beers.
I was there at the time, and it needs concentration. And if it wasn't done that way, it would not have been done. Some of the railroad rights of way would have reverted to landowners. For example, the West Shore Line, which is a great part of the Empire State Trail along the canal, just to the west of Albany, or the Crescent Branch, which runs through Cohoes and stuff.
Yeah.
I was the perpetrator, but I suggest that somebody else solves the problems we didn't solve.
Yeah, so Andy has been going and creating maps to really inventory who is responsible for what and getting MOU signed. So for the Empire State Trail, that's being done. And I think the next steps, and we did have some best practice recommendations for trail maintenance in the trail plan, but going forward is really working with local communities to create these maintenance plans. But Charles from the Albany County Department of Health has had his hand up, so I'm gonna.
Good morning, everybody. I just wanted to bring to people's attention that local health departments and hospitals are obligated periodically to do an assessment of community health and also identify priorities and strategies to address them. And in fact, the next cycle of that needs assessment is in the process of being conducted. It is due to the state on December 31st, 2022. But certainly some of the considerations and integrating the health impact of transportation could contribute to that. In the immediate future, regionally, there's a primary data collection and survey going out to the public at large, and I can share that with Jen to be distributed. The due date is Halloween, October 31st, but this is a way of trying to take the temperature of different residents in terms of their health needs. So we've had a great working relationship with this committee and CDTC. I'll just share with you, in the last cycle of these improvement plans, the Albany County Health Department and many other health departments identified obesity as a significant concern and noted that physical activity was a risk factor to obesity and therefore encouraged, active transportation. So I just wanted to bring to everyone's attention that we're in a cycle of a needs assessment. And as individuals and organizations, I think people around the table here can contribute. And more immediately, there's a survey that people can complete. Thank you.
Thanks, Charles. If you can share that survey, I'll definitely share that with our committee, and then I'll follow up with you, and we can talk about, I know, they identify different priorities, but I guess like how we can make the transportation and the impacts of the transportation system kind of more of a, kind of stress that in order to get like support for us and for other agencies and communities to really, do like a solid assessment of how, how these projects and how these initiatives are affecting health, so that we do think about it differently in the planning process. I think, that's our goal. So, I think that some folks have noted that data collection is valuable, since local governments and other agencies do appreciate and rely on the data. So I think that, for our recommendations for the UPWP obviously will be to continue to work on our data collection program and expand that as we can. And then if it's okay with everyone, I'd like to, propose that some funding be set aside to explore health impact assessments. So not, certain exactly how that'll take shape, but for now, I think that might be a good project, for our advisory committee to work on and to assist on, if that's okay. Okay. So the next agenda item is the tip solicitation. So at our last meeting, we mentioned the new solicitation and the materials that went out on September 10th, we have updated the schedule. So originally applications were due November 5th, but it has been moved to December 3rd. So you know what I'm doing during Christmas week. And the schedule, of course, is definitely, open to be changed again. So you can check the CDTC website to see any changes or updates on that. We did have a tip workshop on September 24th. It was recorded and it's on YouTube. You can find it on the tip solicitation webpage. And there's also a new video that walks you through. There's 2 videos that just focus on the online tip application. There been some questions about this, but we are requiring sponsors to submit their proposals through the online application. We did create a document so you can print out the questions and review them ahead of time, but everything must be submitted through the website. Capital coexists. Some of these projects, again, because of COVID, have either been delayed or unfortunately they're not going to be able to move forward, and that's totally understandable. Other projects have moved forward and been fully implemented. I think we highlighted the Corinth PTSA project last month, but we are continuing to see some really interesting and creative projects. So happy about that. The counting program. So we are just momentarily pausing our counting program. We had a counter stolen from a trail, and we need to, they are, they're not super expensive, but they're pretty valuable pieces of equipment and we can't afford to lose them. So we are going to see if there's a way to better secure them and also to label them. I think that, we try to put them in a place so that they're kind of hidden or don't call attention to themselves. But when people notice them, they do, for whatever reason, suspect a range of things, or they think that they are somehow valuable. But I can assure you that there is nothing that, a random person can do with them. I don't even think that they have scrap value. So, so we are in the process of working with the Troy Police Department to maybe find it. They do have GPS locators. So we'll see if we can locate it or how we'll recover our third counter. But for the moment, we're going to pause and try and make sure that when we do deploy a new one, that we're doing it, that they are secure and they are not stealable. So if anyone has experience with these and, having them stolen or how to not get them stolen, we'd love to hear. Martin, do you have your hand raised?
I do, and I've experienced this myself. We had used 2 counters to count in the preserves in Schenectady County, the Indian Kill and the Plotter Kill. And both those counters are installed by Parks and Trails New York, and unfortunately, both those counters were also stolen. So I think one of the recommendations that Eco Counter has is to construct what would look like a post with holes in it and mount the counter inside the post. And that removes the thought that this is a piece of electronic equipment that has value and instead looks like just a piece of wood or a post that is dug into the ground. Certainly, there's always risk with placing the equipment, but the better you hide it, the more it looks like a piece of landscape or something that doesn't have any value, the less likely it will be stolen. So that's just my only suggestion as far as a way to mask the equipment. So that way it doesn't look like something that could have value to somebody who steals it.
Thank you. And if anyone has any ideas that they want to share later on, or thinks of something maybe, that they can, that like a design, like Martin mentioned, of a post that they would be happy to share or help with, please let us know. We're open to your recommendations. So the Smart Communities Project, we've been following the progress of that here is progressing. The consultant team that we contracted with is WSP with River Street Planning. So we've had our initial meetings, and they will be reaching out to some folks to do focus group meetings. So, bicycle and pedestrian in general, shared mobility, smart mobility, e-mobility is all like a focus of this. So I'm looking forward to seeing like what kind of recommendations or technologies are recommended for the region to explore coming out of this. A Ditch the Car pledge update. Rima, are you able to give an update?
Hi, everybody. Actually, because of holidays and some other things going on, I haven't actually wrapped up the project quite yet. So I think next meeting, I'll be able to give a better update.
Okay. Thanks, Rima.
Yep.
The technical assistance program, many of you are familiar with this. This has been an ongoing program. It is still open, and these are for small scale technical assistance type of initiatives. We will accept applications through December 1st, and you should email techassist@cdrpc.org, or you can give us or CDRPC a call to discuss your proposal, and we will help come up with, decide whether or not it is eligible and come up with the budget and whatnot. So the New Visions Learning Series, again, is a monthly webinar series. And last month we had a presentation on economic development and how the transportation system actually supports economic growth in the region. I think that, if you weren't able to attend, you can see it on our YouTube channel. And I think that some of it would be of interest to our group. We had Katie Newcomb from the Center for Economic Growth, and we had some other, regional economic development folks who talked about getting and promoting the region and speaking with potential employers and other new businesses to relocate to the region and what they're looking for. And a lot of these employers are looking for, they use the terms like livability and walkability, and they want transit access. They like things like bike share and other shared mobility services. So, these are things that sometimes we think of as nice to do projects, but these are really, these are amenities and these are services that businesses are looking for before they locate to a region. They want their employees to be able to get to their office safely and, by other ways besides driving, and their employees are asking for this. They want to live in an area that has trails and has good transit, and where they feel safe walking. So I thought it was great to hear from the economic development folks. Is a different, different area of planning that we don't always hear from. And this month, next Tuesday, we'll have a presentation on the TIP. Now, we did a TIP workshop last month, and this is not going to be a workshop, a step-by-step how to apply, but this is more going to be an overview of the TIP, what happens once your project is on the TIP. So if you are thinking about submitting a proposal for the TIP, but you've never done it before, or you'd like to get familiar with the process, I encourage you to attend. There is a link to register on the New Visions Learning Series website. And then in November, we will do a review of generic environmental impact statements, or GEIS. We have some communities that are using GEIS as a transportation planning tool, evaluating the impact of proposed a new development, collecting fees, and then using that to create infrastructure to support walking and bicycling and transit. So all of the materials and upcoming training opportunities are on our website at cdtcmpo.org. NV2050. You can still request a virtual training. This evening, we'll be doing a planning and zoning board training in the town of Colony on new visions, and it is open to the public, and we're going to really be focusing on complete streets. The status of CDTC planning initiative spreadsheet went out with the agenda, and it will go out on the notes. And again, this really just summarizes the progress on linkage, the technical assistance program, and then other additional planning initiatives. So as some of these move into the recommendations phase, we will be scheduling presentations on them for the advisory committee to see and to provide feedback on. So DOT or CDRPC, do you have any other planning or project updates related to bicycle and pedestrian transportation?
I'm going to turn off mute here. No, not particularly, though we are expecting to be participating with the town of Guilderland on their comprehensive plan update. And so certainly we've been working with them in the past on a set of recommendations through the technical assistance program on trail connections throughout that community. So I would fully expect that some of the recommendations that were identified in that particular study find their way into some elements of their comprehensive plan update.
Thanks. Does anyone from DOT have any updates? TAP CMAC updates or anything? Nope. Okay. So does anyone, we do have some time, if anyone wants to share an update on a planning initiative or project that they're working on?
Yes, I would, Jen. This is Art Clayman from Cycle Schenectady. Well, first of all, one question, this new way of applying for funding for projects and proposals, kind of lumping them all together rather than breaking them out, would that hurt the chance that, you know, other organizations such as mine that would rely on mini grants, would that affect our chances of getting funding for projects?
No, I don't think it's going to affect, you know, your chances for the small scale stuff. And we're keeping the technical assistance program. But it's more of trying to spread out resources more equitably across the region, across different types of communities, and then across our program areas. So, and, you know, we, of course, like funding like trail feasibility studies and trail planning studies, but, you know, so there would be, if 10 communities apply for a trail study, you know, we would probably pick one so that we can also do a transit study and we can also do a freight study. So that's really more of the small scale little grant programs that we have are still kind of, you know, they're going to stay and we're still going to provide that assistance. So, but all the details will be in the solicitation materials, which will go out shortly.
Okay. I'll give you a quick rundown of some of the things we've been involved in recently. Cycle Schenectady, we had a successful ride in the Hamilton Hill neighborhood in mid-September that was led by a city councilwoman from that area who served as our tour guide. We had a group of 12. It was a nice slow ride, and we've done a few of those during the summer where we go around neighborhoods and have somebody knowledgeable about that neighborhood talk to us about the history and culture of the neighborhood when we stopped there. So that was fun. We also teamed up with the Electric City Bike Rescue in Central Park late in September for bike repairs at a bike rodeo at an NAACP Fall Festival. And we've teamed up with the Bike Rescue for various activities like that before. I also participated in a Zoom meeting sponsored by Metroplex Authority to discuss signage on trails in the city with a focus on the so-called Central Park Downtown Connector Trail, which was built 5 or 6 years ago and has nary a sign, although we were promised those. And I remember attending meetings where we talked about signage. So that's finally going to happen. And I think that's the result of my pestering the chairman of the Metroplex Authority for the last 5 years to get signs. And CDTC was involved in that meeting. And I think Jen said it might be the first signage project for a capital region trails plan, which is exciting. So that's about it. Thank you.
Thanks, Art. I do want to mention too, because I think it's interesting. So, when we did the trails plan, we went through the branding and marketing process of trying to create a logo or a brand for the regional trail system. And it was really difficult because even though we identify as the capital region, there wasn't like that one thing that connected all of us. So we ended up with a nice, logo with like the Albany skyline in the background and a trail. And, Schenectady looked at it and said, we like it, but we don't necessarily identify with the Albany skyline, which is a very, valid point. And they asked if they could actually take the Albany skyline and replace it with the Schenectady skyline, but keep the color scheme and everything else. And when you see the proposed logo for Schenectady, it looks great, and it still looks like it's part of the trail system. So it's something for, I guess, other cities, to think about if they want to use that. The Capital District Trails logo is that it is flexible, and you can connect it more to your city or your town. So thanks for reminding me of that project, Art.
And I've got a few other things that came up at our last board meeting that we're thinking about doing or proposing. One of them is a Central Park in Schenectady has a lot of walking activity, at least, and easy places to walk. So one of our members established the fact that there's a beautiful 1 mile loop that takes everybody around to the interesting places there and places where they usually walk, but to make a formally designated 1 mile loop for exercise or to encourage people to use it. And there's kind of a busy road in the middle of it. So when it gets repaved, we would try to get the city to create a separate path for bicyclists and pedestrians there. Another idea is to have a bike corral at the Schenectady Green Market, which is heavily attended Sunday mornings, starts at 10 and finishes at 2, and some kind of secure biking facility, perhaps manned by Cycle Schenectady volunteers, which would help us get out the word about us and our activities. And finally, at one of these bike giveaways, somebody introduced me to some generous donor who gave me a check for quite a bit of money because he liked the idea that we were giving away bikes to kids rather, and with the provision that we do more of the same. So that was the promise. If anybody knows where I can get a lot of bikes after giving away so many with the bike rescue in recent months, get bikes to give away, that would be good. It's harder with bike shops and COVID, and people are holding on to the bikes that they used to give away because they need them or realize that bikes are nice things for their kids to have.
Thanks,
That's
Art.
it for me.
Thanks. James?
Hey, everybody. Ooh. Cool. Art, that sounds really great. You guys are doing a lot of awesome stuff. In Troy, yeah, the counter got stolen off the trail. Obviously, that's a real bummer. We're also having some challenges with getting the separated cycle track on the Green Island Bridge cooperating with the town of Green Island. So if anybody has connections over in the town of Green Island or knows people who live in the town of Green Island who would want a connection over the Green Island Bridge, that would be really helpful. We have implementation money in hand, which is really rare, and we're just having challenges connecting it over with their town. We just completed we're wrapping up a citywide parks plan as well, which doesn't seem transportation related, but I threw a lot of great trail connection stuff in there and made them more accessible and made them operate as like through routes through communities, which is really helpful and kind of like they've been a little bit of barriers in ways, which is kind of rare for parks. And lastly, my last day with the city of Troy is tomorrow. I'll be
My goodness.
leaving and going on to a private planning firm, and probably working a lot with hopefully working a lot with many of you in that role too.
Well, congratulations and thank you, James.
Are you going to tell us which planning firm?
I was going to ask, but
I don't know. I mean, I don't know. I don't know what the rules are. Like the city's scoring a bunch of bids right now, and my firm has bid on a project. So I haven't been telling any of my coworkers which firm I'm going to. But my first day is the 18th. So you all will see me there soon.
okay. So next month we'll find out for sure.
Yeah.
Okay.
And I'll be working a lot on bike and ped projects. So
Great.
you guys can probably guess.
I have an idea. Okay.
If it's the one I think it is, then I'm very excited for you. So congratulations.
Thanks, everyone.
Do we want to start betting? No, I'm just kidding, James. Great. And I mean, I didn't have this in the agenda, but I should mention CDTC is currently hiring. I think there's a great reorganization of people in planning. So we do have positions open at CDTC. So if you're interested, they're on the CDTC website. We are looking for someone who would specialize in public participation and engagement and a transportation planner. So, okay, Tina, you have your hand raised.
Oh wait, and if anyone wants my job too, Jen, add that to the job board.
First, apply to CDC. If no, just kidding.
Apply to both.
We're all competing for the same people. Tina?
Yeah, I just wanted to bring up that I've been trying to get more information up on the city's website. So I have updated the Greenbelt Trail site on the city's website. So it includes all of our engineering studies that we've done to date. So the general public could go onto that website and look. I've actually been also working on something that it's a trail asset inventory because, you know, Jen, you were talking about maintenance, and I think maintenance continues to be a very large issue for cities moving forward and trying to properly budget and how they could budget. So I have a draft of that completed, and I think I'm going to try to get it to you, Jen, to see if you could take a look at it. I also published on the city's website just a snapshot of the bike share map, the heat map, so people could see where the riders have been going. I think that's a really interesting map. I kind of want to compare that. You can compare and contrast what that looks like to the like the Strava heat share map, and those types of users are very different. So, you know, I just kind of wanted to bring that up. If people have seen the heat share maps of their cities, it's interesting to see where the bike share riders are actually going. And we recently, City Council just approved unanimously a resolution for actually implementing the bike lanes within the city. So we're going to be putting a committee together and hopefully seeing how that will take place. Although 4 of our 5 city council members will be leaving, we know for sure at the end of the year. So trying to usher everything through that transition, and hopefully our new city council members will be as willing to work with the group as this one was.
Thanks, Tina. Anyone else? I don't see any hands raised, but you can unmute yourself if you have an update.
Oh, I also wanted to bring up the Saratoga County Trails meeting is scheduled for, I believe, Wednesday. That's tomorrow. Tomorrow night at 5 p.m. at the Saratoga County Planning Office in Ballston Spa.
Is it only in person or is there a virtual option?
You know what? I'll have to.
I don't see a virtual element. I'm sorry.
Okay. I was just checking. Okay. Anyone else?
Jen, I'll speak for the Albany Bicycle Coalition.
Okay.
Real quick, we had Bike to Branches, library to library ride back on September 25th. It was in competition with a couple of things going on that same exact day, the Troy event and a couple other events. So we had approximately a dozen people that participated. There is going to be a daily grind ride this Saturday, the 16th of October. It's going to be conducted by the Albany Bicycle Coalition. This is an annual event. We typically hold this in September, but with COVID and we were trying to put it off or wait and to see, for a safe time but anyway, that's going to start at 9:30 at the Albany Daily Grind on Lark Street and continue over to Troy and back. So everyone's welcome. The Capital New York bike map has been updated by our vice president. We're trying to reach out in the capital region, include more trails, identify more trails. So if people have a chance to take a look at that on our website, and if you see anything that we don't include, that's in the immediate, capital region, please let us know. The other thing I've been tracking is, I think maybe someone from CDTC might be aware of this as well, but Keeler Motor Car on Route 7 is going under a major renovation of their campus. I call it a campus is because they're building all new buildings. They own the land pretty much from that Cumbie Farms, which is fairly new, all the way down to River Road in some portions. They were looking at putting a multi-use path in from the back of Keeler, back of the Cumbie Farms, so that you could connect to the Albany County connector, which is in the British American Boulevard across Route 7. Unfortunately, I had given some comments, attended a Zoom meeting, and they basically have kind of shelved that right now. They're going to the multi-use path. So Rosendale is a horrible connector off Route 7 down to Lions Park or the other Town and Colony Park. But what was interesting was the Town and Colony did say that they would put it on the back burner and try to put make some assessment or put some provisions in the new plan or the new project, so that at least they could do something. What Keeler wanted, they wanted another exit or entrance for their testing their cars. After they do maintenance on them, that would take it directly down to River Road, opposed to access to Route 7. So hopefully that would be a major breakthrough. I asked them if it came down to money, but I think because I said maybe we could put a proposal in through some mechanism, because that is a very weak link in the Empire State Trail supporting network trails. If we can't get that completed or at least looked at again, but that's all I have for right now.
Thanks, John. Anyone else? Okay. Our next meeting is scheduled for November 9th at 9 a.m. It will be virtual. At least that's what we're planning on for now. And if you have any questions or even ideas for anything that we've talked about today, definitely feel free to touch base between now and then. I will be sending out Jody's presentation along again with the executive summaries and with the lessons learned document, which she has already sent me since we heard from her this morning. So yeah, so have a really great week, and I will see you all in November.